We are in the conference room of the Digestive Disease Week 2015 annual meeting. And with Dr. Thompson, the editor of Health and Development magazine, is Dr. Lombardi. She is a surgeon and with a lot of experience in global health issues as they relate to the GI tract. It's my pleasure to have you, Dr. Lombardi. In a few seconds, can you tell me who you are?
My name is KMARIE REID Lombardo. I am a surgeon in hepatobiliary and pancreas surgery at Mayo Clinic.
Thank you very much. Have you had any situation where you have had to do pancreatic surgery because of hepatitis, complicating cirrhosis and related issues?
Yes.
Do you have an idea of any relationship between HIV/AIDS and hepatitis B infection?
Hepatitis B, of course. Certainly in the U.S., we don't see the rates that are present in Africa, on the continent of Africa, but we do know that hepatitis B is a risk for hepatic tumors. So when we see patients who present with tumors, we may screen them to see if that was an underlying risk factor. Or in patients who have cirrhosis, we will screen to ensure that they don't have hepatitis B as a pathology.
Thank you very much. That having been said, what would you say that is the relationship between hepatitis and infant mortality, which is related to GI problems, especially when we have huge cases of diarrhea?
For hepatitis, so of course hepatitis A, an infectious disease process that can occur by contamination, usually with foodborne substances, can lead to having diarrhea and other GI upset and diseases. Usually the chronicity of hepatitis B or C is not manifesting in that way, and it's usually related to hepatitis A. In the U.S., the rates of hepatitis A are lower, and there are vaccines that can be given against it that last on a short-term basis. But of course, globally, this is a bigger issue as there are contaminated water sources, for example, that may lead to the contamination of food that is ingested and lead to diarrhea and other GI upset from hepatitis A.
Do you have any understanding of the relationship between tuberculosis and its involvement in the GI tract?
Yes, and fortunately in the U.S. we don't have to deal with that a lot, but TB-related infections of the GI tract is a definite problem worldwide, and most people will associate TB infection in the lungs, but you can have small bowel and large bowel pathology from TB that can lead to obstruction, an obstructive picture, or bleeding, or diarrhea, and it can cause a lot of morbidity in a patient that has an infection with TB. So in treating patients who have had exposure or travel to other countries that present with GI pathology, it's important to consider that as a possibility in treating those patients.
Yes, there are many intestinal problems which are parasitic in nature. And many of the problems that we have in global health are issues of parasite involvement in GI tract, whether they are Latin American cases or they are in Asia or Eastern Europe or Africa. Let me limit myself to intestinal parasites which have led to intestinal obstruction and there is need for surgery. How would you go about that?
Well, anytime you're approaching a patient with for surgery, you have to treat the impending need. So if they are having an obstructive process, you would have to treat the pathology for the obstruction. In the United States, most of what we see in terms of obstruction are related to adhesion disease from either prior surgery or de novo adhesions, or malignancies or hernias. Those would be the three top things. But in other countries, for patients presenting with obstruction, you have to consider whether they have underlying infectious disease pathologies, like you're saying, with parasitic infections, and you treat them in the same way to eliminate the obstruction. However, you would then have to treat the underlying pathology, and in this scenario, it would be an infectious process, and so they would have to have treatment to treat that underlying disease, which may or may not be available to them, as you know. So, as a surgeon, you would approach it in the same way you do everything else, having protective barrier mechanisms for you and your team, and also making sure that that patient gets the adequate surgical treatment.
For people who are out there, especially those in Africa, in Latin America,
Yes.
in India,
Yes.
in parts of China,
Yes.
who are poor and they are dealing with many of these problems that we have discussed, and they are related to the GI.
Yes.
What would you say are some preventive measures that they should put in place in order to handle them?
Well, one of the easiest preventive measures is to ensure that there's adequate and clean drinking water. Having adequate and clean drinking water can ensure that you reduce the risk of having foodborne contamination, not just from foods, but also from the ingestion of having water that is filled with the spores of different parasites, for example, and even boiling water to reduce, and treating water to reduce some of those natural infections that can occur in those areas. So clean water goes a long way in this instance. And then again, having access to therapy, having access to drugs that are not cost prohibitive in treating patients who don't have the economic sustenance to give most of their salary away to treatment. And that's where the World Health Organization and many other important organizations come into play.
Thank you very much. Apparently, you have addressed most of these issues and advised on how to go about them in a very impressive manner. The last thing I want to ask is, why did you decide to be a surgeon and a GI surgeon?
Well, that's an interesting question. So, from the age of 8, I knew I was going to be a doctor. And then at Washington University, where I trained in medical school as a second-year medical student, Susan McKinnon, who's a plastic surgeon, came and gave a talk about craniofacial reconstruction. And I knew instantly that I wanted to go into a field where I can facilitate a change, a modification, and give hope to a patient in a direct way using my hands. And so I was immediately drawn to surgery. Initially wanted to do plastic surgery, and then when I saw the small bowel and liver, I changed right away into wanting to do GI surgery. And so I followed that passion through all of my adult life to where I am today.
Thank you very, very much. I would